hope o ka aina. Hiki mai ka elele o ka loko.
Ano aime ke aloha in the Makamaka, and welcome to A Second Glance, where we take an in-depth look at issues in and around Hawaii. Today's subject deals with issues in healthcare. And as I get into this particular subject, I want to first make a disclosure that I am the executive director of an organization which approximately 25 years ago had asked the State Department of Health, the mental health division of it, to leave the community because we were dissatisfied with the services that was being provided to the community at that time. This is the community of Waianae. As a result of this request, we formed what is now known as the Waianae Coast Community Mental Health Center. And as I said, I am the executive director of that mental health center. The Mental Health Center, having been in existence for about 25 years, is the only community mental health center that is not controlled by the state of Hawaii and its Department of Health. Our community mental health center is directly controlled by the community. We have community members who are members of the board of directors. I am from the community, and the large majority of our employees are from the community. Of course, our clients, our patients are to a large extent from the community as well. So this is a truly community-based mental health center. And in our center, we provide adult serious mental illness services. We provide alcohol and drug treatment services. We have, for the adult clients, we have group homes for the seriously mentally ill. We provide 57 beds for those who otherwise may end up being homeless or living in situations that may be unsafe or unpleasant for the clients. We also have a clubhouse where the clients can attend just to enjoy a social life and not be only seen as a person with an illness, but as a human being who has many different aspects of his life. In our center, we also provide children's services, the only community mental health center that not only provides a wide array of adult services, but children's services as well. And there we provide a therapeutic foster home. By the way, if you are interested in being a parent for our foster home, you can get in touch with our office, and we will try to find a way to accommodate you. Our telephone number, and this may not be shown on the screen, that I would want you to call is 696-4211, and you can inquire about becoming a parent for our foster home program. We also have another program that is called a Neighborhood Place program that tries to address the tensions, the difficulties that families normally come across. So before arising to a condition of either child abuse or drug abuse or homelessness, we try to ameliorate the issues that families may be facing. And if we cannot provide the service, we try to look around in the community to see what other services might be available that you can avail yourself for your family too. So we have quite a well-rounded group of services. Our services are nationally accredited through a national organization we call CARF. Okay, so with all of that said, what I wanted to do was give you an insight, and perhaps an insight in my own thinking with regards to the way health is looked at and what changes are occurring in the health services today. We have received, and we often receive from America, from an organization known as SAMHSA. It's dealing with substance abuse and mental health administration. It's a federal administration that may come out with different kinds of models of practice, the appropriate way that we do it in Middle America, and we would like you folks to use these, what they call best practices. But sometimes these best practices do not really reflect the culture of the community, the economic conditions in the community, or the type of clients and the particular influences that the community economics or culture or different incidents may have that shapes the wellness of a community. So we were asked a few years ago that they wanted, or the State Department of Health wanted us to roll out a form of best practices that comes from SAMHSA. And we said that we would be more than happy to work on that model, but we needed to adjust it for the cultural and the social circumstance of Waianae. And so they agreed, and we took 2 years, and we met with our staff, we met with members of the community, we met with our clients, and we reformulated, or some people would say, Poka, you folks indigenized the so-called best practice that came from SAMHSA. And so we changed the language, we changed the approach to deal with the issue of mental illness. In that particular case, it was illness management and recovery. It was taking the idea that clients or patients could really understand and reason why they were ill. And so they began this idea of informing the client what happens in the human brain, what kind of juices get shot out or is not enough being shot out, and as a result, the kind of serotonin or other chemicals in the brain, excuse me, what kind of chemicals in the brain affects one's attitudes and behaviors or hearing voices and the rest. Through the use of chemicals, pharmaceuticals, you can control how the brain functions, and you can control whether or not you have enough of these chemicals being excreted or not. And so medication plays a very important role in the maintenance of wellness in terms of mental illness. They also said that one's social affairs, one's neighbors and friends and interaction or failure to interact with others would also have a very deep impression on the illness that one has. So if you want to remain healthy, be sure you take your medicine as required and develop a strong social support system so that you can maintain good health. We took this best practice model to teach the clients about the importance of medication and social support. And we asked ourselves, do we agree? And we agreed that this was an appropriate way of treating clients. But we also said that we think there are certain elements missing. One is the issue of spirituality. The normal circumstance when a person begins to act differently or begins to speak to voices that he may hear or images that he may see, or feels very depressed and begins to seclude himself or acts in a way that is outside of the normal trend. What we normally do is not to run to a psychiatrist. In fact, we don't normally run to a doctor. What we normally do is we consult, usually with members of the family or with the elder within the family, or we may go to temple or to church or to see a priest that we have associated with and consult there. To immediately go to a psychiatrist is not the normal operation or method of conduct that we have. And so we said that there seems to be a missing piece in this formulation, and that is the spiritual aspect, by which many of our people still rely on a sense of spirituality. So we opened up that avenue, and we said not that every person has some pilikia or some difficulties in that area, but at least we need to open that venue to provide the consumer's family with the opportunity to check out and to resolve that issue. I remember a client who was very seriously mentally ill, kept babbling to himself and hearing voices of ghosts or people who have died previously. His story was a story not uncommon in Hawaii. He was told to dig a grave. And he told his Luna, or his supervisor, I cannot dig the grave. It's just not something I can do. So he, as a Hapto operator, was told by the supervisor, either dig the grave or go home, don't come back again. So left without really any choice, he went ahead and he dug out the grave. The next day he couldn't come back to work because he was so bothered by hearing voices of at least what he assumed was the dead whose grave he had dug up. By taking him to the Western practice of mental illness and bringing him to a psychiatrist, the psychiatrist treated him with a diagnosis of schizophrenia, that he was hearing voices that were not really there. And so by medicating him, there were, of course, some side effects from the medication, but the person never got well. Okay. When I heard about the case, I was somewhat upset and asked about the reference to maybe a healer in his own tradition. He was a local person of native Hawaiian tradition. And it got to a point where it was just too late, and he eventually passed on. These kinds of opportunities we cannot let get away from us. At least if we had the sensitivity to understand that this avenue needs to be opened and given an opportunity to be exhausted. As I said, it's not every Hawaiian patient who needs to go and see a kahuna first before you take them to the doctor. But at least this is an option that needs to be placed within a person's recovery plan. Okay. So what we said was this illness management and recovery program is a good program, but it needs to have added a spiritual component, and we need to include that in the master recovery plan. What we also said was that we are finding some of our clients who are not able to adjust to that quick movement within our society in which we are losing the anchors within our communities. No longer are places familiar where, in Waianae, for example, where the new theater was. It was quite an old theater, but compared to the other theater, this was the open-air new theater. There's no such new theater anymore. A place known as Pokai is no longer what we had known as Pokai. Now they call a beach area Pokai rather than the coconut grove behind the new theater, which is now the Hongwanji. As places change, people are losing the anchors that they had, the familiarity, the signs of safety. There's no access up into the mountains that they knew. To get to the ocean, it seems to be very difficult. And even if you can get into the ocean is not the same as it had been before. Getting to be able to fish, you have to go further out. You need a boat instead of just standing on the reef. These changes are occurring in our society that a person feels that the situation has changed. His aina has changed. Not only his aina, his housing situation may be one of homelessness now. his economic situation, there's no jobs around. So many of the conditions that a person comes from has been altered. And as a result, that has affected issues of mental illness. Just to be homeless in Hawaii, living down the beach with a different circumstance, with strangers walking back and forth by your tent, with the uncertainty of safety, all of these issues, and the caring for children, especially in these conditions, it would be a very unusual person who would not suffer from some degree of mental illness as a result of these conditions. So what we did in this program is, first we changed the name. Instead of Illness Management and Recovery, we now call it Voyage to Recovery, using a traditional Hawaiian voyaging concept. And we said that in our recovery program, we shall have this Kanaka section that deals with what happens in the brain, what happens to a person's social environment, and how that factors into getting him to recover. But we also need to open up that spiritual basis and allow for the influences or the treatment through the physical, spiritual side. We also had the Aina component. The spiritual component we call the Akua component. The Aina component was the environmental component. And we said all of these need to be in consonance with one another. So it's a different type of program that we are talking about, a more comprehensive look at a human being and all of the factors that affect his mental illness or his wellness. That was about 3 or 4 years ago. And as we worked with this program, what we then said was, why is it that we have been caught up in this idea of separating different treatments or different illnesses for one human being? If a person suffers from alcohol and drug addiction, we treat them with alcohol and drug services, which our agency treats for. And then we take a look at whether or not they are also suffering from mental illness. And oftentimes what happens is a person who suffers from mental illness will self-medicate because he cannot get the services or the medication. And there's other reasons for turning to alcohol and drug. It's not only the seriously mentally ill who will self-medicate, but that is part of the problem. So oftentimes we find that a person who suffers from mental illness will also engage in taking of some kind of illicit drugs. And yet we tend to treat that as separate. So this great idea of what we call dual diagnosis. Dual diagnosis is when a person suffers from mental illness or one form of mental illness, and in this particular case, alcohol and drug addiction. And so we've learned how to put the two together, and this is very new because for a long time they have been separated. You have an addiction service, treatment service, separate from a mental health clinic. Okay. So what we're doing is, what we have done is we've put this together. But we were saying that's really not enough. What about the primary health care need of that individual? The person may suffer from obesity, they may suffer from diabetes, from heart disease, from a number of other what we call chronic illnesses that comes about and has been there for the last, let's say, 6 months and expected to continue for a much longer time. Many of these illnesses are based not on the physical characteristic of the individual or the susceptibility, well, perhaps a susceptibility, but it's not innate that the individual will have that illness. Oftentimes it is a matter of behavior because of his lifestyle or his inability to effectively negotiate or address the change condition. They begin to fail to exercise, they're not eating nutritious meals, and for many other reasons, the behavior changes and affects the chronic illness. And what we are also finding is that when people talk about the high expense of illness, of health services, we are finding that the health service cost is skyrocketing because those who are suffering from serious mental illness, when their services are not well coordinated with the primary healthcare service, and when their alcohol and drug services are not coordinated with all of this, then you find a lot of these clients going to the primary healthcare provider or going to the emergency room because they have a headache or because they have a sore thumb, and it may be, of course, much more serious illness because they fail to take their medication and they're suffering from heart palpitations or whatever the issue is, that you skyrocket in the primary healthcare costs. So some bright guy came out with the idea, and we did about 3 years ago. We said, you cannot continue to separate a human being from these services. So what we need to do is incorporate a primary healthcare service with a mental health care service, with the alcohol and drug services, and get your specialties in together, and they should all participate in the creation of the master recovery program. And it's very important that you pay attention to the term recovery, because we are not talking about merely maintaining a person's illness and just keep them on the line of not sort of falling off the edges of unacceptable behavior or not falling off the edge of death. Yeah? So what we are talking about is having the person recover from that illness, even mental illness. The older idea is, well, once mentally ill, that's the best you're going to get, and what we can do, or what we'll try to do, is just maintain you at this level. But what we are saying is, no, that's not good enough. We want you to recover. Taking the language from alcohol and drug treatment, where people are talking about recovering from that illness. We're talking about recovering from mental illness. We're talking about recovering from your chronic illness. Diabetes, for example, why not recover from it instead of only maintaining you at that level? Obesity, why not recover from it? Okay. So by bringing all of this together, we are saying, now this is at least a more holistic, what the language is now is integrated approach towards illness or towards health services. The recent Affordable Care Act from the federal government, sometimes called Obamacare, has said that as we provide broader services, we want some of these states to try out this new method called the integrated or home health care services, where you bring in the primary health care physician, you bring in the psychiatrist, you bring in the drug treatment services. What we are saying is we are willing to do that. We have developed a program, but more important than leaving or having only these three service providers, most important is what I consider to be the most important is a case manager, because that's a person who will tie all of these services together. By just bringing these services in, you have some of the primary healthcare facilities that may have a psychiatrist, may have a psychologist, may have some treatment for alcohol and drugs, and a primary healthcare physician. But unless it's tied together and it's worked together through the case manager, a person who is able to make the checks, to go out, to have, to meet with a client in his home or wherever the client may be, to have accessibility or the client accessible to that person. That's what you really need in these types of programs. So we've developed a program. The Office of Hawaiian Affairs have been willing to sponsor at least a trial model of this program, and we're now running a trial model. The message that I want to get to you, though, is not to explain where we are at, excuse me, but to tell you where we all must go to. You see, a primary healthcare physician, a psychologist or psychiatrist, a person doing drug and alcohol treatment, even with a case manager, is still not enough. What we are talking about is wellness. They use the term integration of services. Have you ever thought, when was it that we disintegrated health services? When was it that we had the doctor separate from the psychiatrist, from the drug treatment program? And is that all that illness or wellness is all about? What happened to 2 or 3 other very basic aspects of wellness? What happened to nutrition and appropriate nutrition? What happened to exercise, appropriate exercise? What happened to maintaining a strong spiritual and cultural sense of who you are, of who we are, of who our community is? Those are the primary preventive measures of good health care, and we are simply not paying enough attention. So while we create Medicaid, we create other government services, and we try to pay attention to the high cost of these primary health care, mental health care, alcohol and drug treatment, we are not putting enough emphasis to a truly holistic and integrated service. And as long as we look to governments to do that, as long as we look to those who are now providing these specialized services to do that, as long as we continue to have a system that services the pharmaceuticals, as long as we continue to have a system that is answerable only to the HMOs, the health maintenance organizations, or the insurance companies, we are going to lose the battle. What we need to do is start thinking for ourselves and start taking control of our own health care, to understand that the foundation of good health is nutrition. The foundation of good health is exercise, activities. Do something. The foundation of good health is to be secure in who you are, what your culture is, what your sense of spirituality is. Man is not merely a human being made up of skin and bones, but there is also a spiritual nature that is important in the formation of wellness for us, for the community. I know that normally you would not listen to a person involved in the healthcare system to do the preaching to you. But I'm suggesting that this is so important that we cannot not think for ourselves. We need to start finding ways, our own ways. Don't wait until you get sick or you enter in the system. And if you have entered the system, find a way to think for yourself and provide yourself with appropriate health care. I'm about out of time. I want to thank you very much for allowing me into your homes to speak with you. Aloha, ahui ho.
Kaulana nā pua o Hawaii Kupa'a mahope o ka aina Iki mai ka elele o ka loko i